Hi guys, welcome to the show. Today my guest is Richard Ward. Rick is senior advisor at BDC Advisor LLC, and he's also CEO at the Ward Health Science Inc. Welcome to the show, Richard. Thank you so much. Thank you so much for your time today.
Well, nice to be here.
If you can start, walk us through, Rick, what are these two roles? How does what's involved in these two roles in your side?
Sure. Well, Reward Health Sciences and BDC Advisors are both organizations that work with healthcare companies. Mm-hmm. So that would include at large academic medical centers or a hospital system or a health plan, health insurance company. And BDC Advisors helps those organizations by providing strategic consulting services. And Reward Health is focused more on information technology and analytics, try to develop innovative technologies and help the organizations figure out how to put technology to good use to accomplish, especially the more critical parts of their healthcare mission.
I see. Is primarily in the US or is also in Canada as well, Rick?
Primarily in the U.S. We have done a tiny amount of work here in Windsor and a little bit in the Toronto area where you are. Mm-hmm. But most of our work has been in the U.S. But I have an interest in actually doing more work in Canada. I actually live in Windsor, Ontario, mm-hmm. across the river from Detroit. And so I am myself a patient and dependent on the Canadian healthcare system, and so therefore I'm motivated to make it as good as it can be.
I get you. So, and then primarily consulting. What is the data modeling? How does the data modeling come into that? I was reading your blog and I saw that you guys were involved in data modeling for COVID and for hospitals in the US. How does that come into play in this?
Yeah, so healthcare organizations during COVID have had to figure out what their role is. Mm-hmm. I think it might be useful for your listeners to understand an important distinction between population health and the healthcare system versus public health and what government public health agencies provide. And this is also true in Canada and the US. And those two, healthcare organizations are obviously taking care of individual people and their diseases and conditions and tests and procedures. Everyone's familiar with that. Mm-hmm. Public health is treating a whole population, trying to keep restaurants with, from healthy practices and deal with pandemics and this kind of thing. Well, there's a lot of overlap, especially since for the last couple of decades, one of the biggest trends in healthcare has been to try to think as a population health perspective, meaning rather than just being reactive to what's happening to the individual patient, healthcare organizations have been working, and that's part of what we've been helping them with, help to take a more proactive population-oriented approach to take responsibility for the care of a population. Mm-hmm. Things like tracking who needs what preventive services and systematically trying to promote wellness. Those are things that healthcare organizations are doing. Well, that has created more and more overlap between healthcare and public health. So who's supposed to give a vaccine? Mm-hmm. Who's supposed to do a test when you have COVID? Who's mm-hmm. supposed to do contact tracing to figure out who else has it? Who's supposed to work with the community members to implement other kind of mitigation strategies? So that's raised a lot of question among our clients about how they can properly carry out their responsibilities, how they could play an important role. And I do think it really represents one of the silver linings, if there are some between, with the COVID pandemic, is that it's forced some questions and encourage some discussions and collaborative work that I think will have benefits beyond the pandemic.
And to that to the point, I see that Canada government from your website that they released ethic framework, and you had a take on that. And what are the key differences you think that Canada government the ethic frameworks they provide for public decision makers, or what do you think the shortfalls are, or what could they do better job at it?
Well, one is so let's start with the operations.
Yeah.
So when you're dealing with COVID or anything complicated, it's obviously going to require a lot of different people to work effectively together, to coordinate their efforts and to share data and share metrics and share decision-making together in order to accomplish it. And so that's been one of the chronic problems with healthcare organizations. And now that we're trying to figure out how healthcare fits in with public health, it just picks on that scab. It makes that problem worse. So I think the remedy is to try to take the existing structures that exist in communities for public health and the new structures that we've been helping organizations develop, accountable care organizations, clinically integrated networks, hospital systems, health information exchange. These are all things that we've been doing in the healthcare system to try to make people work together more effectively and share data more effectively. So we got to connect those two things together, including government, public health, and private healthcare organizations. And then the second thing that I think is really an important point, Gurmeet, is the analytics. So there's been, in my opinion, a longstanding problem that COVID has really shone a bright light on. And that is too much of our analytics are rear view mirror analytics. They're taking data about the past and just summarizing and counting them. And there's value to doing that. But what we need to know is to support decisions is we need to know what's going to happen in the future under different scenarios. If we choose policy A or policy B, which one is going to lead to a better group of outcomes? There's going to be advantages and disadvantages of A and B, and we need to pick one or the other to move forward. And we can't wait and try A and try B and see which one is better. We have to model the future. We have to do simulations. We have to do projections into the future under different scenarios. And I think that's the weakest part of our analytics in both public health and in healthcare organizations.
Oh, that's a very interesting point, Rick. So how do we fill the gap? The data we have in the past, and we're trying to make a future decision on that, and there's no room for errors in that. That's a big gap to fill. So stimulation is one thing you mentioned. Is there something else governments can do? Historical data is not going to, guide you to making that, 100% right decision in the future. So how do they go about it? How do they predict based on the historical data when they're making future decisions?
Well, I think the key thing, I like to use the phrase model in the middle. It is like a lot of people seem to, in the field of analytics, they look around and they see what data is conveniently lying around because they don't want to do work. They just want to grab that which is next to them and readily available. And then they ask themselves, what interesting things can we answer with this data? But that's not necessarily the important things. That's not really the decision you want to make. And that leads to organizations just having like a lot of graphs and a lot of data in the room, but doesn't really feel like they're making decisions based on that data. The data isn't changing minds, and the data isn't really that relevant to the actual A-B decision that you're making. And so I think that, if you look around the world of analytics and where it's working the best, it's clearest to people in the finance department or the bank. The financial sector, they're very good at this. If you went to go to a bank to take out a loan for a new business venture or to expand the plant or something, they would, of course, demand that you have some projections. You'd have to have pro forma financial statements about how that's going to be sustainable economically. Mm-hmm. And so they develop spreadsheets and they make assumptions and they try to have data to back up those assumptions. Other assumptions, they don't have data, but a credible expert has said that's a good assumption. And so it's very familiar to people in the finance area to talk about models. They might not use the word model. They might not use the word simulation. Mm-hmm. They might use words like projection or budget or pro formas or financials. But that doesn't really happen very much on the clinical side or the clinical operations side. And that's where I think there's a big opportunity for us going forward. So I've been a big fan of simulation modeling. And that's what we're spending a lot of our time working on right now, is using especially a particular type of simulation that we're very bullish on, and that is agent-based modeling. So that means simplifying what otherwise would have been really complicated spreadsheets and really complicated formulas that would be used for traditional epidemiologic models, for example. Those can get very complicated very fast when you start to take into account many different things that you need to take into account. And what we're very bullish on agent-based modeling because it has this great property of allowing the model to be quite simple and still deal with a lot of complexity. And the reason why it's only becoming popular now in healthcare is because of in the past, the computing power required for that hasn't been readily available. Mm-hmm. And now that's not really an issue. We can simulate in computer memory a whole population of people and a variety of things about them, and run that simulation forward without hardly, the computer is hardly getting out of breath doing it, where just 5 years ago, 10 years ago, that was a lot less affordable to do.
Mm-hmm. Mm-hmm. But making decision as policymakers are making on a daily basis during the pandemic or even before the pandemic, how much room is there that data's not, if they don't have the right data, how are they going to make a decision on that? So what is the danger there, or is there risk involved in that they're making decision, which is they cannot make it on a past data. They have to make a decision right there and then, what to close down, what to open, on economically. What do you think? Any risk there? With your thoughts?
Well, I think the obvious answer is that you have to always be making your decisions based on the best available information. Mm-hmm. I mean, it seems true just by saying it, right? You can't use information that you don't have, and you want to use the best that you have. Mm-hmm. And so good decision making leverages all of the information that you have. And the more that you can collect information of a higher quality intentionally, and the more you could extract the information that's available through, for example, an electronic medical record, or information that's available through many public databases or private proprietary databases. There's lots of sensor data. There's lots of data from location data, for example, that can be used effectively. So I think it's a duty to anyone trying to support pandemic decisions or any consequential healthcare decisions to do the work, to try to figure out creative ways to leverage the data that's available all around us, to do the work of systematically collecting key data elements that we've been only haphazardly collecting before. But then don't let that, you're never going to have all the data that you need, because we've never had this pandemic before. This is a novel disease and we don't know a lot of things about it. And so we can't let the lack of data on particular things, even important things, cripple our ability to make a projection. We just have to make assumptions where we have missing data. We have to vet those assumptions with experts. We have to be honest about the range of uncertainty around those assumptions. So we can't pretend that our model is going to precisely predict where the hurricane is going to hit the land. It's going to hit on John's house. No, you don't know that. It's going to hit somewhere in this 40-mile range. You have to be honest about that. But I think too many people have viewed modeling in the pandemic as if its only purpose was making an accurate prediction of exactly what's going to happen. Mm-hmm. And I think that purpose is a distraction. Like the purpose is to bring together our best information mm-hmm. and compare alternative pathways that we're deciding between in a coherent, defensible, transparent way mm-hmm. so that we can pick A versus B. And maybe we're wrong, maybe we're right, but it did its job of bringing together the best information available at the time we needed to make a decision.
Interesting. So at least it's enabling people to make the best decision that possibly they can. I guess that's the information. Very interesting.
And I think that becomes more important in something like the pandemic, because we have to admit that because we don't know a lot, these models are going to frequently be wrong. Mm-hmm. And that doesn't disprove modeling. Mm-hmm. That's just a reflection of our current state of our best available information.
Did anything change during the COVID that, the way we were modeling data before, the way we were looking at the data, or maybe something was less important, now it become more important? Will anything change in that regard during the COVID?
I think the biggest thing is taking into account and leveraging sensor data that's much more widely available than last time we had a serious pandemic. Mm-hmm. And so, for example, location data and all other kinds of data that are collected for other purposes through internet-based transactions and e-commerce and other purposes, and figuring out clever ways. So, for example, analysts need to estimate when you do when a public health official makes a pronouncement about a particular type of lockdown, that's going to have some health benefits, that's going to have some economic harms. Mm-hmm. Like people are going to be hungry because they're unemployed, because their business shut down because of that lockdown. Yep. And so it's consequential in both directions. And we have so little information about if a public policy maker says these words in a policy, what will actually happen in the population and how long will that last? Mm-hmm. And so you could bring to bear sensor data about location of people and come up with metrics like, what percentage of people each day, whether their maximum distance from their resident, was it 1 mile, was it 1 mile or less, or 10 miles or more, and other various variations on that theme to try to get an objective measure of the degree to which the policy led people to stay home and limit their contacts with other people. Mm-hmm. And so that's been game-changing in the analytics of COVID compared to what was available in previous public health emergencies.
You think that it will stay the way it is right now? So we'll continue the same location-based gathering data or many different scenarios, or will it go back to the way we were doing things before COVID?
I think it'll continue to change. I think one interesting, at the beginning of the pandemic, remember there was a lot of talk about the important role of contact tracing apps on a phone. Yep. Because people were thinking, wow, rather than like finding a lab result of somebody and then chasing after, trying to call them on the phone and have them remember who they talked to and they forget, and then you can't reach people. Contact tracing is a lot of work, and it has a lot of error. And people said, we all are carrying these things.
Yeah.
We know where we are. We know who we came in contact with.
Mm-hmm.
And I think that early buzz and early enthusiasm long ago, earlier in the year,
Mm-hmm.
seems like,
Yeah.
doesn't it seem like it was a decade ago?
Yeah. Yeah.
But at the beginning, people were all working. I was on a number of calls about initiatives about this, and there was a lot of excitement. And I think it kind of fell flat. Even the one that we have in Ontario here,
Mm-hmm.
the uptake by the population in using it has been very low, and therefore it hasn't really been used. And I think that the reason for that was that there was too much pushback, I think,
From
about
people.
privacy concerns.
Mm-hmm.
People didn't like their phone tracking them, even though the darn phone is tracking them. They don't want to acknowledge the degree to which that's already happening, but they don't want to sign up for more.
Mm-hmm.
And so therefore, I think that what I would predict happens or needs to happen, what I hope would happen,
Mm-hmm.
is that we would have a mobile phone based system that people sign up for and use, and that there's proper incentives
Mm-hmm.
to provide benefits to the people who agree to use it. And most importantly, is there has to be a really tight framework to give people confidence and trust that it will only be used for this narrow purposes, controlled by in this transparent way.
Mm-hmm.
It won't be something that is going to be used for nefarious or authoritarian purposes or anything else that gets people's fear level up.
Mm-hmm. In Canada, I see easy as a public health system. I'm not sure how is that like in the US, but I see a point that people are willing to give more privacy or more consent to use their information in exchange of more benefits, health benefits or whatever benefits, economic benefits. So they're willing to make a compromise on the privacy a little bit to gain benefit of their side.
Yeah. I mean, we're spending a lot of money and we're losing a lot of money on the pandemic all over the world.
Yeah. Yeah.
And so thinking through how you can incentivize people, even economically,
mm-hmm.
to be willing to provide the good input data needed for a public health surveillance system that really works and a contact tracing system that really works.
Yeah.
I think that would be a very worthwhile expenditure of tax dollars.
Mm-hmm. So let me ask you from a leadership standpoint, right? You work with a lot of leaders on a, in a hospital side or a private sector, and you work a lot with the technology. What challenges do you see even before COVID and now? My discussion with a lot of leaders over the time is even the leadership skills are changing with the COVID. What we thought the skills, you don't have a luxury of putting everybody in a room to educate and lead and get your expectations out. So even leaderships have to change the ways that they were leading people before. What do you see the challenges before before even COVID? From what are you trying to do? What kind of challenges do you see that they go through when you're dealing with them?
Well, Gurmeet, I think the number one challenge before and during COVID, really it's been always the same, is trust.
Okay.
I think that a lot of the most important things that we do in organizations, and not just healthcare organizations, I'm certain this is true about any other kind of business, mm-hmm. Is you got to do things with other people. Sometimes those other people are your supplier or your distributor or, external organizations. Sometimes they're your competitor in some mm-hmm. ways, and you got to work with them to accomplish your goals. And then even within your organization, you've got somebody's from, the sales department, someone's from operations, someone's from finance, someone's from IT. Mm-hmm. And those are all departments that sometimes don't trust one another. They don't trust that if I share this data or if I give up control of this thing or if I make this change that they want me to make, it's going to hurt me. So I think building trust between people that are involved in your enterprise, inside and outside, is the number one objective, I think, for a leader.
And how about technology piece of it? Technology is easily acceptable. Change is usually a seen as a big, threat to an organization. It's not easy to carry out change. And what you're presenting, what you deal with simply data modeling is always introducing change to a business, either with technology change or people decide to change, and trust is another part of it, which you just mentioned. So how's that seen in organizations that you deal with? You see the leadership struggling with the change and technology in an organization.
Yeah, that's a good point. And again, I think that COVID didn't really make it fundamentally different. It just shine a light on things that were there all along.
Yeah.
And if I had to get it down to one word, Gurmeet, I would say superficial. Yeah. Is the problem, is that when people are thinking about technology in their own organization, or the technologies that allow them to work with other organizations, like an integrated network of healthcare organizations, I find in my conversations with senior leaders in client organizations is the most important thing is to get them to get past kind of a checklist mentality of, the trade publication says, I need some of this. I need some big data. I need some AI. I need some whatever it is. It's shiny objects that they want to check off so that they can say they're doing it. And the challenge is to get those people who don't see themselves as technology people. Sometimes they're even a bit intimidated by technology. They don't want to talk about it too much because it might reveal something that they don't know, make them look bad. And so what we try to do when we're advising senior leaders about technology is to invite them more boldly into the conversation and drive it deeper to say, what are the core capabilities that we need that are really important to the organization? Okay. Not the superficial feature or whether we have or don't have this technology, but drive it down to deeper capabilities. And in particular, Gurmeet, I think the way that we do that is by getting them to recognize their core processes that are the most important ones. And then think about the technology capabilities that would be enabling or help them to improve those core processes. So if you get the conversation to be mostly about process, and then what are the technologies that we support that with, rather than what technologies I'm supposed to check off. That's the big challenge. And I think as advisors and consultants, the biggest value that we can bring to organizations is to help the leaders more boldly dive into those conversations and own them and not shy away from them.
See, so how do they manage the balance rate? Leaders have a job to do. They have to move the organization forward. They have a vision. They want to get to that. And at the same time, they don't want to lose the trust with the people. They don't, they're getting a pushback from people. How do they find a balance between those two? You don't want to push so far forward in a business and then you lose the trust with the people. At the same time, you're getting a pushback from people. How do they find a balance between those two?
Well, two points I think that pop into my mind. One is when you focus on process, everyone that you're working with will be drawn towards the conversation because everyone cares about that. At the end of the day, people care about their promotion and their turf and and the raise that they want to get, their incentive. They do care about all those, but everyone works because they have some commitment to the customer and some commitment to the mission. And in healthcare, it's probably easier than in other industries because it's so blatantly obvious that the mission is an important good thing. But I think that's true in every industry if you think about it the right way. And then I think the second thing is to help people have aligned incentives so that those incentives, their turf, their raise, aren't working against your effort to improve the process. And that's what, like in healthcare, what we've been doing for a couple of decades is, for example, changing the contracts so that when a healthcare organization contracts with a health plan, the payment isn't just fee for service, where every time you do more things, you get paid more money. You want it to be, that payment to be more based on quality and overall performance, including economic performance, so that you're aligned incentives with the population, so that, yeah, you're trying to do a lot of good care, but you're also trying to intentionally avoid doing unnecessary care.
Gotcha.
And you align the incentives. And then the last thing, I think, maybe this just kind of goes under trust again, is you have to create a culture where change is something that people get credit for pursuing. That it's not just success. It's like if you're just sitting there doing nothing, you want your organizational culture to have that make you feel bad. Like you should always be changing. Sometimes you're going to successfully make it an improvement. Sometimes you're going to, the puck is going to go wide and miss the goal, but you got to be taking shots in our culture. And I think that's an important thing that a leader, an executive leader, a CEO can instill in the culture of their organization.
That's definitely the vision that, if you have a company, organization has a vision, people need to align with that. So, they feel. So how do you, when you guys working with the organization, do you work on a process level, on a strategy level, on a vision level, or all three when you approach the audience?
That's a great question, Gurmeet. I mean, I think the loud answer is yes, all three. And that's part of the reason why I do some work with Reward Health and some work with BDC is there's a little bit of a separation there of strategy and vision and new business entities and sort of board level stuff. And then there's the technology stuff. And in a lot of our projects, they require both. And one of the challenges that I talk about sometimes is the walking down the mountain challenge. So you start this strategic conversation with the CEO and the boardroom about, where are we going as an academic medical center? Where are we going? What markets should we get into? Should we be merging in? Should we start a new accountable care organization? Should we go into this new product direction? Very strategic things. And it's the world of boardroom meetings and PowerPoint slides and a few Excel spreadsheets. That's strategy.
Yeah.
But then all of that is for nothing unless you can start to implement it across the organization, in which case you have to get involved with people in the regional office, in the individual departments, and then you're piloting something. And so now you're down in the weeds in the context of a pilot that might have enterprise importance, but the actual work is like nuts and bolts. It's very detailed. And so I really feel strongly that consultancies that, when their rate card is so high that they can only work in the boardroom, it fundamentally limits the ability to have an impact on an organization.
Exactly. And that is a critical key, not only deploying those processes, but also holding hands and making sure those processes run smoothly over the time, because that's what's going to feed up to the strategy overall, So do you build processes, Rick, or do you implement them on a daily basis, or you help them execute those as well to this organization, and also coach people how to change the work environment according to new process? How far do you go down on a deeper level?
Well, it depends on the organization, really. So sometimes the organizations are very, very large, and and so we kind of help with the first few steps, but at some point, you're rolling it out to the organization, and our involvement is really just to kind of check in periodically. How's it going?
I see. Anything
else that we can do? But I do, I mentioned the notion of a pilot, and I'm a big fan of when organizations, I don't know, living across the river from Detroit, Michigan, and having worked there for so many years, there's a lot of automotive analogies.
Yeah.
And I don't know if you remember the Saturn car company. Maybe this is not a good, it ultimately was unsuccessful and went out of business. So maybe this isn't a good example. But I fundamentally believed in what GM was trying to do with that, which is we want to do something in a fundamentally different ways. And incrementally moving a whole bunch of old rusty things in a general direction is going to take us too long. And so we need to establish something that is more fundamentally different so that people can look at it and understand what it is, and that can help us transform everything else. And I think that's like how you do disruption inside an organization, as opposed to somebody being a new startup disrupting you.
Yeah.
How do you not be a victim of destruction, but how do you accomplish it successfully inside your organization? You do that by cocooning off certain things that you really want to be the subject of innovation. And personally, that's the part I find most rewarding in the work is to go from, a conversation with senior leadership about a vision, and then go straight to building out all the little details, but in a small, controllable, cocooned off pilot of something.
Yeah, that's a great point, Rick. You made. Innovation doesn't have to be a new product. It has to be, most of the large organizations, the innovation has to come within. What's a new way of doing things? And COVID forced a lot of companies to innovate. Even though whatever they delivered before, now they have to find a new ways of delivering product and services. So it's simply, what worked before, it may not work after COVID. So if you were, use example for products, if you were, used to have a storefront, people came and buy product, now it's online. So that changed a lot of dynamics. So even though they're building the same product after COVID, but their delivery system, or they have to innovate new ways of getting that in the hands of people. How much that changed in your, industry that people have to innovate new ways of, they're forced to find a new ways of either delivering data or delivering services to people.
Well, I think that's a great point, Gurmeet, that COVID, people think of it as, they see it correctly as an emergency and like no time to waste. And so they're, organizations that we've been working with, they'll set up like a little command center. We got to have a room, and we're going to put stuff on the wall, and we're going to meet there every day, and we're going to have a Zoom call every day. And because we're working the problem, because it's an urgent, encompassing problem. And that's totally valuable, totally necessary. And it builds a new habit of decisiveness, of being able to move forward without perfect information, about being able to allow the person sitting next to you to make a decisive decision, and you go along with it, if you generally agree with it, as opposed to reacting to it by saying, no, I don't want to accept that you get to decide that, because that overlaps my thing. There's no time for that. You just, the enemy is approaching. And so what my sincere hope is, Gurmeet, is that these habits that people are developing will live on, that they represent an opportunity for a mind change of people to be more decisive and more collaborative because they need to.
Whether it's out of no choice or people have to, working remotely, like you and I talking, is one of those things that it was around for a long time, but it was nice to have, opportunity to work from home. But now, all of a sudden, it's by no choice, right? So,
Yes.
to the point, you're making that, before we had a little bit of time, so we were, we will take our time to make a decision, but now you have to make a decision. There's no two ways about it.
Yep.
Yeah. And you think that carries over after COVID, even the COVID passes, Rick, that the same mindset will stay with people?
Are you saying, do I think it will happen?
Yeah, it will, people will stay in the same state that, the urgency in business, because, once the COVID is finished, another thing people have to do is now they have to get back to businesses, especially the private businesses. The revenue has to go up, the sales have to go up, so will they carry on the same mindset and in the same approaches, or will they go back to, pre-COVID?
Well, I like to be an optimist, and so I would like to say yes. I think that, of course, realistically, once the fog is lifted and everyone is so, eager to get back to their normal life, there's going to be a little bit of a New Year's Eve scene. when everyone is
meeting in person again. Yeah.
And I think everyone will be eager to get back into all their old habits, but I think that some of these new habits will stick with us. And I think that as leaders, we should, take advantage of an opportunity that's presented itself and try as best we can to kindle some of the good ones continuing. Like you mentioned, I think the familiarity with working virtually, both clinically, taking care of patients. Yeah. My wife is a speech language pathologist, and she's in the next room over there, treating. Wow. And so that's that never happened before. And, I think a lot of healthcare organizations were very untrusting. They figured that if people were allowed to not have to come and sit in the chair where they could see them, that they would just goof off. Yeah. And I think now they have more trust. It goes back to that trust idea, more familiarity with doing things a new way.
Yeah, definitely. It helps a lot of people, especially business has no choice, right? So I think it's a time for a lot of leaders to build a trust with the people as well. Accountability is there, transparency is there, technology allows you to do all that stuff. So yes. you can be comfortable with the people that, they're accountable what they're doing.
Absolutely.
And what are your thoughts on leadership, Rick? Definitely, when everything's open, businesses are going back to, that they want to scale up, where they were. What can they do now? Either, they're gonna need new leadership skills to manage people because everybody's not in the same room anymore, or they have to find how they're gonna make people accountable or the transparency. What can they do? Business leaders now, they can sharpen their skill set, or they can prepare themselves so when the opportunity does come, they're ready to roll with that.
Well, obviously that's going to be very different depending on what business, what kind of business you're in. Mm-hmm. I think in healthcare, they need to be prepared for the snapback of all the things that people have been putting off. Yeah. That, basically the intensive care unit has gone up in demand, but any kind of procedure that was elective has gone down. Yeah. And even like preventive services and screening for cancers and tumors and stuff gone way down. So now as soon as you have that first little wave of now we do the mammogram and we discover there's a lot of tumors to be addressed, and we do some other tests and we discover there's going to be a huge wave after the infectious disease wave passes us of all the stuff that was buried and delayed, put off, that we're going to have to deal with. So I think if you're in healthcare, my advice to you is be planning for that. We've got waves of the pandemic, but we also have the big wave of everything else once this goes by. And maybe that's going to be true in other industries too. I imagine is that if you're in a restaurant industry or retail industry or you're manufacturing something that people haven't been buying because they don't have the money or because they can't use it. Like if you're selling surfboards or I don't know what, that there's going to be this whoosh at the end of it, and then it's going to go back down. So you have to be able to make yourself more flexible, I guess.
Hopefully people learn from this pandemic that they know how to deal with the waves, I guess. So we've gone through a couple of them. So maybe that information we gather or the experience we gained during this COVID, that could be put to use even after this, that the new wave comes in.
Yeah. And as far as going back to sort of our underlying topic of technology, that sort of the industry that you and I share, is a lot of systems I think have been developed over years to do the process a certain way.
Yeah.
And they're designed for those requirements. For those process requirements, they design a system. And if you go to change the process, then everyone gets mad because you got your requirements wrong.
Yeah.
And then, but you should say, but my job is to change the process because my job is to improve the process.
Got it.
And every improvement is by definition a change. And so I think the implication of that, Gurmeet, is that organizations in any industry need their systems to be things that design change as something the system is capable of doing and that it supports. So, more flexible workflow automation, more flexible separation of business logic and rules from the hard-coded application logic itself. So those things that you can do to make, on a technology level, your organization more agile, more flexible, more adjustable, improvable.
Yeah, more the flexibility into those systems if there's already built into the ground up. I mean, you can adjust that as you go along, right? Otherwise, how do you change the process without a flexibility built into it?
Yeah.
And definitely what we do, Rick, is we are live and breathe process. If you can tweak a process, you can get to strategy very fast. Only way to get to strategy in our world is simply changing the process. If you can adjust the process, that is a flexibility, you can get to strategy roadmap much faster, whatever you want to get to. Interesting. In technology side, do you see any challenges on the technology side as well, Rick, with your engagement with the businesses? Is there technology challenges as well, or simply just a flexibility into process?
Can you say the question again?
So technology, is there technology challenges as well? Is there better technology or some countries doing better than us in North America? Or what challenges in the technology side you see? Is there more of a skill gap, or is there simply more tools that the technology is gonna develop that AI is one of those things. A lot of companies spending a lot of investment into AI to build that into their technology, so make that tools much intelligent or much faster.
Well, about AI in particular, I think it's very important component of many solutions. It's irrelevant to many other solutions, and I'm a fan of it. I was developing predictive models and neural networks in the 90s. I published a paper in early 90s on a neural network, basically artificial intelligence to project which people would benefit from hip replacement surgery. Okay. So I'm a fan of it and have been since before it was cool. But a concern that I have in this regard is that I think a lot of organizations are too enamored with the shiny object. And it goes back to what we were talking about before, about if you're focusing on the process and the needs of a process end up something that you need to improve can be improved using a machine learning algorithm or a predictive model or AI, that's great. Or the same thing for big data, the same thing for mobile sensors, the same thing for IoT, the same thing, any of those buzzwords that venture capitalists are so fond of. But my advice to people is resist the temptation to just dive into something because it sounds cool.
Yeah.
And just stick to your guns of the boringer work.
Yeah.
That's not really a word.
Yeah.
But the Lord's work of improving the process, incrementally, and also set up that pilot to improve the process transformationally. You do both of those and only grab onto the technologies when and if you need them.
Yeah, so I see on a lot of technologies where, financial sector is one, or manufacturing, it is making a big, move on that. You see a lot of softwares coming out recently, or hardware, a lot of AI components built into intelligence. That's what makes software, and hardware more intelligence. And IBM is behind that big push as well. Do you see a lot of AI's, components coming into medical field as well? Is it already there, or are they, where you see that behind, or what their state?
Well, I think they're already there. I think actually the healthcare industry and biotech industry are probably among the places where it really was developed.
It much more sense.
Exactly. Sort of, it's coming from healthcare and then leaking out into other industries. So there's always been diagnostic imaging algorithms, and there's always been AI and neural nets and machine learning. Those are all kind of very related terms. Have been an important part of healthcare all along, and I fully expect them to continue to grow. And I think that young people that are learning technology, coming in, studying at school, are really need to pay attention to that and understand those algorithms, those methods, and understand what they're for and what they're not for. And I would say that I come in contact with a lot of healthcare or digital healthcare startups, and I would say, don't take this as solid data, but my impression is 80% of them have their business, their slide deck, their introductory slide deck, or their elevator speech. 80% of the new ones have machine learning or AI as part of their story.
Wow.
It's become, and they come up with, most of them, it has nothing to do with the essence of what the value, that the problem that they're trying to solve. And they come up with the most harebrained explanations of why they need AI or why they need machine learning. They just know that it's got to be on the slide deck for them to get funded. So I think that's an unfortunate thing, but so right now we're in that fad phase, and that'll die down some pretty soon. I predict in 1 year. But I think there's a very important residual, just as there was with big data, just as there was with a number of other of these fatty waves that we've both lived through.
Nice. Wow, there's so much to learn from. The technology changes and everything changes around it, so there's so much to learn from. Any thoughts you want to leave for the business leaders or leadership team itself in any industry? Rick, what are your thoughts on a leadership that what should they prepare for? Going back to businesses, anything you want to share that what they should be mindful of? Any thoughts on that?
Well, we talked about trust.
Yeah.
We talked about aligning incentives. That's a big one. Another one that I think is very important always is talent. Is sort of finding, attracting, retaining, developing the talent of the team. I think that one of the terms that we use a lot is a 10Xer.
Yeah.
And what that term means to us is, there's some jobs that by their nature, that if you look at the performance of a group of people doing the job, there's always, of course, there's a natural distribution of people as far as their performance. And some jobs, you might, like the high performer compared to the median or the low performer, you might be talking about a 10% difference, which is very important, to be 10% better, more efficient or more productive.
Yeah.
But then there's a lot of jobs and many of the jobs of the future, it's more like 10x.
Yeah.
Where one person who has insight and talent and drive, combined with the right training and cultural and motivational attributes, is as productive as 10 other average people trying to do that job. Yeah. And I think analytics and IT system development are definitely in that category. That the standout people are so much more productive, and we can somewhat decrease that with better methods like agile development methods and better requirements and integrating testing into development. There's all kinds of things that you're familiar with that we're trying to do as a technology industry to reduce that performance variation. But I think it's only all of those things together, which are all very important things to do, but they only add up to a modest reduction. The big effect is still if someone has insight and talent. So I think if I'm a leader in an IT organization, or if I'm a leader of a CEO of a company, I want to be thinking about how I can attract and retain, and even how I can identify in the first place, the people that really have the most talent and insight, whatever background they come from. They come from all different places. I need to be creative in finding them, so I got to figure out how I can tell the difference between the people that are or are not, and how to attract them and retain them and develop that talent.
I see. Yeah, that's a great point. The complex problem is still out there to solve for people. And end of the day, it's people who solve those problems. Either whether it's technology problem or a process problem. End of the day, you're gonna need those people, the trust with the people and highly qualified people to help you to solve those problems. Very interesting. Where can people find you, Rick, if they want to connect with you? Where can they find you? Where can they connect with you?
Well, the easiest is our website, rewardhealth.com.
Okay.
And that has many ways of contacting us. And that also, I have a blog on there that I offer comments on various topics, mostly related to healthcare and health information technology, but sometimes I get off topic and talk about random things.
Very interesting. I had a couple of reads on that. It was very interesting. A lot of information, a lot to learn from, definitely. Okay. All right, good stuff. Thank you so much for your time. I learned a lot from you, Rick, and thank you so much for your time. It was a pleasure talking to you.
Well, thank you I was glad to virtually get to know you a little bit, meet, and thank you for the invitation.
All right, you're welcome. Thank you so much.
Take care.
Okay, bye-bye.